if we don't have the pregnant woman or the couple to make it a duty to access the services, whether at the facility or now at the community level, because we've realized that not everyone wants to come to hospital or clinic for antenatal services, and of course, not every woman wants to come to hospital or clinic to deliver. For the last 2 decades, if we look back 20 years from now, we see a response that has been emerging and building momentum. At the last 3 years, I can say that momentum reaches the crescendo, the critical limit, and the output we are seeing has been remarkably different from what has happened before the last 3 years. So the last 3 years of the last 20 years of HIV response in Nigeria has been a turning point. We've seen growth in the number of people that are living with HIV/AIDS. We have on our register receiving treatment and also continue to receive treatment, have their virus suppressed. And you know, once that virus is suppressed, if we don't see it, it doesn't get transmitted to other people. The 40% access to treatment generally was at 2016. Things have changed from 2016 to date. And if you're looking nationally, the number we have that have access to treatment now is almost 90%. We have 1.6 million out of a total of 1.8 million people living with HIV/AIDS that have access to treatment. When you look at the children, number of new HIV infections that have been detected among newborn, we have an estimated number of about 21,000 annually that happens based on our estimation. But in terms of the number that died from HIV, is not 13 out of the 22 that are newly identified. But you're talking of 13,000 out of about 150,000 children that are living with HIV/AIDS in Nigeria. What we are looking at going forward is to expand access to mother-to-child transmission of HIV. And the way we plan to do it is to have people realize that the newborn or the unborn baby has right to be protected from HIV. And this starts with not only with the mother, but the parents in general. Mother and father should know that the unborn baby under their custody has right to be protected from HIV. And if that creation has right to be protected from HIV, the mother must, as a matter of responsibility, ensure she has access to HIV testing services during that pregnancy. If the mother is HIV positive, treatment should start in earnest immediately, and delivery should be at a facility where measures will be taken to prevent mother-to-child transmission during delivery, immediately after delivery, and during the breastfeeding period. We've been working over the last year or 1.5 years, immediately after the lockdown, which is one of the period where the inequalities or gap in terms of access was very prominent. Immediately after that, in terms of access to HIV services, access to testing services, access to treatment services, we have seen a jump that we haven't seen in the years before COVID. And this is because we divide into groups. Some of us are in the conventional clinic and facilities where people come to traditionally access services, including HIV services. And some of us go to the community. They go near the individual's household and provide services at the community to improve access to testing services, as well as access to treatment services. Key population have been the key drivers of HIV transmission and HIV acquisition. In terms of how we access them, over the last 2.5 years, that has also significantly changed. We've expanded in terms of the venue where services are provided. We call it one-stop shop. People come there, either they were referred by their co-individuals or peers in their network, or they are referred by healthcare providers or service providers that work in the community. And this number of one-stop shop has jumped from as little as 10 in the last 2.5 years to now over 100, where key affected population receive services that ranges from testing, treatment, and counseling. The federal government has tremendously increased funding for HIV, from supporting the treatment of 50,000 individuals 2 years back to now supporting 100,000 treatment of 100,000 people living with HIV/AIDS, and determined to add additional 50,000 next year to make it 150,000. On the other hand, the private sector is also coming together to form the HIV Trust Fund of Nigeria. This is similar to the role private sector played during COVID-19 pandemic with creation of COVID. We are looking at similar structure this time around addressing HIV. And addressing HIV is squarely addressing the issue of sustainability. We are working with National Human Rights Commission. When we get cases of human rights violation, stigmatization and discrimination, there is a legal unit that look at the cases and refer to the relevant unit at the National Human Rights Commission to take up the case, support the individual involved, and making sure that justice is served. There are devices for prevention newly launched, and now they are tested across the globe. There are devices for testing, and there are new treatment modalities. They are all out there. Prominent among is the HIV self-testing. These are devices that provide individual opportunity to test themselves, to know their HIV status at the comfort of their rooms. Sit down in your room, use your body fluid, saliva in particular, test yourself to know whether you have HIV. Within 20 minutes, 15 to 20 minutes, the result is out. You can read it, and you can also interpret it given the guide that is provided that come with the test. In terms of new mode of treatment, apart from what we do now conventionally, where we give patients living with HIV drugs of multiple months. We call it multi-month dispensing. When they go, we don't see them until after 3 months, and that gives them significant break in terms of them frequenting hospital every month to take medication. So that one we're doing already. But one thing that has come up now and is practiced somewhere is the injectable HIV drugs. The injectable HIV drugs are drugs that are given every two months, and now it is looking like it's possible to give every three months in a year, meaning someone will show up at the clinic and take this injection like 4 times or 6 times, and that's all. And this is especially convenient for patients that feel uncomfortable taking pills every day, or that find it very, very difficult to adhere to the regimen of taking this drug on daily basis. They can have this injection, and after 2 months they can come for another one, or after 3 months they can come for another one, depending on the spacing interval. So this is something that was not there before, and now is there. And with time, we're looking at probably expanding that spacing interval to up to 6 months. So you'll be looking at someone coming to take this medication only twice in a year. Come after 6 months, come for the next injection, and they are done. And the virus will be very well suppressed in them. It hasn't commenced in Nigeria, as with drugs that are newly launched and devices that are very recent. The cost is prohibitive at the beginning, but with time, more donation comes in and more subsidies are provided. The cost crash and come down. We are hoping in a year from now, such new technologies should be available here, and people who want to benefit from them. Nigerians now know their HIV status more than they were doing in the last 10 years from now. It's remarkable that people are accepting HIV testing, and people are even demanding for HIV testing. And we are reaching to a stage where you may not even need to campaign for people to access HIV testing because of the existing awareness. But people will just come forward to demand for the test because they've realized that HIV no longer kills because medication are available. And if you can take this medication and take them very well, then the virus will disappear from your blood, and it will no longer disturb your system and will not leave you to affect your loved ones.